force. Since January, the daily confirmed cases in the world exceeded 3.5 million cases. According to WHO, in the past 1 month, among all the genes, 85% of the virus is Omicron. So it has a very fast transmission, and this will replace the other variant. So right now, China is faced with the challenge posed by Delta as well as the Omicron. And also we are faced with a lot of challenges of the imported infection. Now we're about to enter into the stage of the Spring Festival travel rush. We are faced with unprecedented challenge right now. We have to speed up the epidemiological investigation, screening, and isolation. We have to identify all the confirmed cases as soon as possible and curb the spread of the virus. We have to make sure that the virus will not be spreading out of this city. We need to do our best to provide supplies and also to serve our people with their medical needs, making sure that all the requests of our people can be met. For places with no epidemic, they have to stay vigilant and exercise normalized prevention and control measures. They have to identify the risks as soon as possible and take targeted measures on nucleic acid testing and other prevention measures. We have to speed up the vaccination progress. As of January the 14th, a total report of 2.928 billion doses of vaccines have been administered. 1.21 billion people have been fully vaccinated. For today's press conference, the topic is focusing on the prevention and control measures during the holiday. We are glad to be joined by experts from Ministry of Education, Mr. Wang Dongfeng, Mr. Zhong from Ministry of Transport, Mr. He Qinghua from the Disease Control Bureau of National Health Commission, Mr. Han Guangzhu from the Civil Aviation Administration, Mr. Zhu Wen from the China Railway Group. They will address the questions from the media. Now the floor is open for questions. Please identify your media affiliation before you raise the question. With CMG. So my question is, what is the current situation of the epidemic in China? I would like to turn over to Mr. He Qinghua to answer your question. Thank you for your question. Right now, we are seeing the global pandemic still accelerating, and also we are seeing an increased number of confirmed cases. Now, we still face a big challenge for the imported infection. And right now, we are approaching to the Spring Festival and the winter holiday for the students. So that means we will have a big increase of the flow of the population. In face with the current situation, right now the epidemic situation is stable. For certain areas, we may see some of the cluster outbreak, but we are able to contain the spread of the virus in short time. For the Omicron outbreak in Tianjin, it already affected Anyang city in Hunan province and also in Liaoning province. But right now we are still seeing an upward trend for the Tianjin. But for most of the confirmed cases are actually found from the isolation, the quarantine site. So we don't have a big risk for the outreaching of the virus. We have to better manage the prevention and control measures in the quarantine site. For the epidemic situation, in Anyang, we still have some risk of the spreading of the virus. And for the epidemic in Xi'an, actually we are coming to the last stage. But still we have to pay attention to the prevention and control in the hospitals and the quarantine sites. In the city of Zhengzhou and Xuchang of Henan province, and right now we are seeing a declining trend of the confirmed cases. The situation is improving in general, and we don't have much risk of spreading out of the virus. And for the epidemic in Shenzhen, most of the confirmed cases are found from those quarantined personnel. So for the case reported in Zhuhai, and the case reported in Zhongshan, and the case reported from Shanghai, for these 3 confirmed cases, they are Omicron virus. And as these people, they have traveled from a lot of places, there may be a risk of the spreading of the virus. For the case reported in Hangzhou City, and now we are still at the early stage, and we have to screen the close contacts and the high-risk group of population. And recently, the interagency task force of the State Council already sent out expert team to the Tianjin. We will pay close attention to the risky areas to screen out the high-risk population and also to monitor the situation of different cities. And we have to do our best to early identify the possible cases and to put off the epidemic as soon as possible in order to make sure that our people can enjoy a happy Spring Festival. Thank you. Next question, please. With China Education Television, we have noted that for campus and universities, it is densely populated with the students. What measures will be taken by the Ministry of Education to curb the spread of the virus inside of the campus? I would like to turn over to Mr. Wang Dengfeng to answer your question. Thank you for your attention to the epidemic prevention and control work in the universities and the colleges. For the campus, in terms of the epidemic prevention and control, we may face some of the challenges. First of all, you mentioned for the campus and the universities, it is densely populated. And also these students may have a wide contact with people from different parts of China, and now we are entering into the season of the winter holiday. Some of the students will return to their hometown. So this may affect many regions of China. We have big population, and also we will have a big flow of this population. Second, for the universities and the campus, they belong to different jurisdictions. So we have to make sure that the local cities and the places can be accountable for the prevention control work in the universities and the campus. So for some of the universities, they are under the jurisdiction of provinces, and some of them are under the municipalities. So for different places, they may have different measures for the epidemic prevention and control. Especially when an emergency occurs, we have to make sure that the universities and the campuses, they can work together with the local authority to curb the spread of the virus. So this is one of the challenges. Third, for the universities, once we found suspected cases, we may impose lockdown for the universities. So that means we have to provide daily necessities and supplies to students and teachers staying inside of the campus. For example, if one university has tens of thousands of people, first of all, we have to make sure they could study inside of the campus, and also we are able to provide the anti-epidemic supplies to these students. So these are the 3 challenges faced by the universities. According to the guidance of the Ministry of Education, and right now we all know we are entering into the winter holiday, we are focusing on 4 areas. First, we have to strengthen our awareness of the responsibility to make sure that we could exercise all the normalized prevention and control measures. So just now, my colleague from the Disease Control Bureau gave us a short introduction about the situation of the epidemic. For certain places, they may have sporadic cases or cluster outbreak. For the universities and campuses, so we have to do a good job in normalized prevention and control measures. So no matter you are in a risky region or you are in a risk-free region, so we have to make sure that for all of our students and teachers, they could abide by the instructions of the epidemic prevention and control. So this is the basic for us to make sure everything goes well. Even though the school and the universities are located in the low-risk region, they still have to abide by the epidemic and the prevention measures. Second, we have to do a good job for the emergency handling. Once there is an epidemic in certain places, we have to roll out the contingency plan as soon as possible. So regardless of the location of the epidemic, once we found the epidemic, for some of the students, if they're in their hometown, still they have to abide by our rules for the epidemic prevention and control. This is of crucial importance to the campus. As I just mentioned, for all of these universities, they have to work together with the local authorities. So this requires that for all of these universities, they have to exercise the contingency plan. So once we found the epidemic, and then we could kick off this contingency plan as soon as possible. We have to exercise the normalized or routine prevention and control measures. So once there is a loophole in our routine measures, and then we are able to have this contingency plan in place. This is a very important part for us. And for students or teachers who have already returned to their hometown, if there was an epidemic occurred in their hometown, or if they have any contact of the close contacts or the secondary close contacts, they have to follow the guidance of the epidemic prevention and control published by the local authority. For example, right now we are seeing the epidemic occurred in the city of Tianjin. For some of the students, they have already returned to their hometown. There are a great amount of people returning to Tianjin in the winter holiday. So they have to report to their local community as soon as possible and receive the nucleic acid testing. This is also a very important part for all the students and the teachers. And also this is part of our contingency plan. Third, we have to provide humanitarian care to our students and the teachers. No matter where they are, whether they are in the school or out of the school, for those who are staying in the campus, we have to provide psychological counseling to them and also offer daily necessities to these people. And for those who have already returned to their hometown, we have to monitor their health condition on a routine basis. So all in all of these people have to abide by the prevention and control measures. Fourth, for all the measures of epidemic prevention and control on campus and in universities, we have to review each item of the measures, making sure that all of these measures can be implemented thoroughly. Thank you. Next question, please. With China Transport Daily. As we just mentioned, right now we do have sporadic cases occurred in different parts of China. So my understanding is what measures will be taken by the Ministry of Transport to mitigate the risk of the transmission of the virus. Thank you. Thank you for your question. So right now we are seeing many cities in China had cluster outbreak. For Ministry of Transport, we have to make sure that the virus will not be transmitted through the transportation means, and at the same time, we have to make sure that we are able to provide cargo transportation. So first, we have to take a scientific control measures to make sure that the virus cannot be spreaded to other parts of China. And also, we will provide guidance to the transportation authorities in high-risk and mid-risk regions. So they will suspend some of the cargo transportation, and also they will stop the service of the cross-country, cross-city transportation. And second, we have to provide guidance to different cities. Especially, we will instruct the transportation authorities if they will pass some of the high or mid-risk regions. They need to make a detour to mitigate the risk of the spreading of the virus. Third, we have to set up inspection points. We will work with the National Health Commission and the Public Security Bureau to set up the inspection sites. So we have to be compliant, and we have to check the health codes of all the passing by vehicles and the personnel, and at the same time we have to educate the public about the recent policies. Fourth, we have to take strict measures on all the prevention and control measures, and also we have to do a good job in the disinfection for all the transportation means, vehicles, and terminals, etc. And at the same time, for some of the vehicles that need to bring and pass the samples of the close contacts or the secondary close contacts, we have to do a good job to ensure the safety of the drivers and people who are transporting all of those samples. And at the same time, we have to take multiple measures to make sure that we could have smooth transportation of the cargo and the supplies. First, we have to make sure that we are able to transport the anti-epidemic supplies, especially for some of the emergent supplies. We will issue a valid pass to the vehicles, and also we will set up the connection points, and we are able to improve our capability in deliver all of these supplies. For example, we will deliver the daily necessities for our people, and also we need to ensure that all the vaccines can be delivered as soon as possible. And right now, we've found some of the situation in certain places. For example, they will bring some of the drivers for quarantine. And after further investigation, we are able to handle all of these issues. For the traffic control, we should not take a sweeping approach, especially the inspection site shall not be arranged at the highways, and also it should not block the traffic in the certain trunk roads. So that said, we need to exercise all the epidemic prevention and control measures, but we shall not impede the transportation of the daily necessities and supplies for our people. And also, we have to pay attention to the road transportation and the water transportation. And right now, we are faced a lot of challenge posed by the imported infection. And right now, we are able to transport some of the daily goods to the Tianjin ports. And in general, we have good order in the ports in Tianjin, and they have just completed the second round of the nucleic acid testing citywide. And today, for the Tianjin port, the third round of the nucleic acid testing have been kicked off. And for all of people who are working at those risky regions, areas, they have already completed the booster shots. And for Henan, Tianjin, and Shanxi, we also set up the interagency task force for the transportation in those cities. If there are any transportation issues, they could dial the hotline for the interagency task force. If you have any needs of, for example, the coordination of the transportation, you could actually reach out to the Ministry of Transport from the State Council Interagency Task Force. Thank you. Next question, please. With People's Daily. So right now we're approaching to the Spring Festival travel rush. My question is to the China Railway. What measures will be taken by the China Railway Group to mitigate the risk of the transmission of the virus? And any reminders to people who take trains during the Spring Festival travel rush? Thank you for your attention to the railway work. In 2022, we are faced by dual challenges posed by the travel and the spreading of the virus. We will earnestly implement the instructions made by the CPC Central Committee and the State Council. And we will do a good job in ensuring the safety and health of our passengers. So right now, if we look at the ticket sold this year, in 2021, the majority of the passenger flow will centralize for the migrant workers, people visiting relatives, and the students. But still, faced with the uncertainties of the epidemic in different cities, it may also pose some of the uncertainties of the passenger flow. So we are taking 4 measures. First, we will take a scientific approach in arranging the transport capacity. So on a daily basis, we are able to provide 10.05 million seats on the trains. This has increased by 10% compared to the previous year, and this will meet the needs of the travel of the passengers. And also, we are taking a lot of targeted measures. We will arrange the number of trains in accordance of the traffic and the passenger flow to make sure that we could meet the needs of our people for their travel and also to meet the needs of the prevention and control of the epidemic. Second, we will adopt a more scientific ticket selling method. And also, we will monitor the situation in the train stations to provide scattered seat options for the passengers. And also, we will provide the 24-hour service of the return of the tickets. By doing that, we are able to allow all the passengers to handle some of their travel online. And also, we adjust some of the policies for the return. This will save the cost for the passengers, and also this will provide a flexible option for the passengers. Third, we will take strict epidemic prevention and control measures. And we will strengthen our management in the train stations. We will check the temperature for the passengers and also to check their health code. And also we will provide flexible SIP options for the passengers. And also we will stop the dine-in services for the passengers. Instead, we will provide take-out food to the passengers. Also, we will do a good job for the ventilation of the train stations. And also, we will monitor the environment for the train stations and the trains. And if we found there was some epidemic happened in certain places, we'll work with the local government and adjust the transportation. We will suspend the trains, or we will stop some of the trains. And also, we will stop selling tickets to the passengers who would like to travel to the epidemic-related regions to make sure that the virus will not be transmitted through the railway. And at the same time, we will roll out the return policy so that we could save some of the cost for our passengers. We have to work together with our people. So by taking this opportunity, I would like to send out some reminders to the passengers. As it is quite dynamic in arranging the selling of the tickets. For example, for certain places, if we think we have a big demand, and then we will offer more tickets and open up more trains. So please pay attention to the announcement made on our official website, that 12306. And also you could download the application from the 12306 so that you could get a better understanding of the epidemic prevention and control measures in the departure place and your destination. And also, we are providing other services, for example, the e-pass for the passengers. So we strongly advise for all the passengers to download our 12306 application to handle your travel. And the second, right now, we have bring a lot of services online. So make sure you could use the internet or use the self-service stations to monitor your travel and to mitigate the transmission of the virus. And during the travel, please mind your own hygiene and also to listen to the instructions of the staff members and exercise social distancing during your travel. Thank you. Next question, please. With Xinhua News Agency. Right now, Omicron already lead to cluster outbreak in China. So is it possible that we will upgrade some of the containment measures in China and any other special measures to deal with Omicron? I would like to turn over to Mr. He Qinghua to answer your question. As you said, so right now we have 14 provinces and cities reported Omicron imported cases, including Henan province and the Tianjin, and they also reported local cases with Omicron. So right now for Omicron, this virus have already passed to over 150 countries and regions. For certain countries, most of their variants are Omicron. So with the transmission of this variant, actually Omicron can be transmitted to China through human touch or objects, according to our analysis. For this variant, it will not have an impact to the effectiveness of the nucleic acid testing in China. And China still abide by the general guideline on the preventing imported infection and domestic rebound, and also we are focusing on the prevention of the transmission through human and objects. For all the inbound personnel, we will strengthen our efforts for checking their personal health, and also we will do a good job in the disinfection for all the inbound flights and the aircrafts. So first, we are focusing on the human transmission, and also second, we will focusing on objects, the inbound objects and also the inbound aircraft. So in order to prevent the domestic rebound, we will continue to roll out the health monitoring for key groups of people and the key facilities. And the second, we will continue our efforts to roll out the vaccination to the public. And third, we will guide our general public to exercise the routine epidemic prevention and control measures. For example, wash their hands frequently, wear a mask, and exercise social distancing. And all of these efforts will help to contain the spread of the virus. Going next, the National Health Commission will continue to follow the latest situation of the epidemic in the world, and especially will pay attention to the variant of the virus. And also we will analyze the situation of the imported infection, and based on our analysis, we will adjust the prevention and control measures so that we could safeguard our hard-won efforts for the prevention and the control of the epidemic. Thank you. Next question, please. With Civil Aviation paper, so soon we will start the Spring Festival travel rush. My question is to Civil Aviation Administration. What work have you done to ensure the Spring Festival travel rush could be a safe one? So Mr. Han Guangzu will take your question. So during the Spring Festival travel rush, we follow the guidance of the CBC Central Committee, and also we are focusing on several areas in arranging our flights and provide the guidance on the staff members on providing services. So first of all, we were focusing on the general guideline to prevent the imported infection and domestic rebound. We will adjust our policies in accordance to the actual situation to make sure that we could implement all of the prevention and control measures. And also, for some of the popular destinations, the Civil Aviation Administration will encourage the airline companies to adjust their flights so as to meet the needs of the passengers. As of now, we have already arranged over 600,000 airlines, and also we will potentially add over 200,000 flights. At the same time, we will follow the epidemic situation in different places and offer good services to the passengers. So for the local aviation administration, they work together with the local government so that they could provide better services to the passengers. During the Spring Festival, the Civil Aviation Administration will stay at the front line to make sure that we have a safe travel of the civil aviation, and we are able to provide the epidemic and the prevention for the customers and our clients. Thank you. Next question, please. With South Weekly. So right now we are at the stage of the winter holiday, and many students are coming back to their hometown. There may be a high risk for the transmission of the virus. My question is to Ministry of Education. As for the flow of the students, what measures will be taken by the Ministry of Education to mitigate the risk of the transmission of the virus? Thank you. So right now it is the winter holiday, and for some of the universities, some of the students already about to return to their hometown. So during the travel for our students, we are focusing on 4 aspects. First, we pay attention to the time of the winter holiday. So we are providing customized policies to different places and different universities. On one hand, we have to pay attention to the progress of the studies of our students, and the second, we have to pay attention to the epidemic prevention and control measures in different places. By looking at all of these situations, so the local places and the local authorities will come up with different plans for the winter holiday of these universities and the campuses. And the second, we have to pay attention to the prevention and control measures during the travel for the students and the teachers. So for the universities, they have to educate the staff members and the students on the latest prevention and control measures. For example, we will advise them not to travel to densely populated places, and they have to wear their mask throughout their travel. Third, during the winter holiday, for some of the teachers and students, they will stay at home, and some of them will choose to stay on campus. And soon, the Ministry of Education will publish a health guideline so that it could supervise the behavior and also some of the travel activities of the students and the staff members. And fourth, we have to monitor the health of our teachers and the students. No matter where you are, we have a clear guidance for health monitoring. For example, for all the teachers and the students, they have to monitor their temperature on a daily basis. If they're feeling uncomfortable, they have to report their physical situation back to the universities. By taking all of those measures in place, it could make sure that all of our students and the teachers would stay safe during the winter holiday. Thank you. Next question, please. With CMG, the Finance Center. So the Spring Festival travel rush will kick off soon. So what are some of the features for this year's Spring Festival travel rush? So what measures will be taken by the Ministry of Transport to provide the services and guarantee the services to our general public? Thank you for your question. In view of the current situation, the Ministry of Transport will work with the Civil Aviation Administration and the China Railway. We will analyze the passenger flow for the Spring Festival travel rush. So it is estimated that we will send out a total of passengers of 1.1 billion people. This will have 35% increase compared to 2021 and down by 20% as compared to 2020. And down by 60.4% compared to 2019, which is before the epidemic. So for this year's Spring Festival travel rush, we will find we still have a huge amount of passenger flow, and also more people would like to travel before and after the holiday. And at the same time, we are faced with a lot of challenges posed by the imported infection and domestic rebound. And also, we are faced some of the challenges posed by the service guarantee. In order to do a good job in the 2022 Spring Festival travel rush, we will focus on 4 areas of work. So first, we will pay attention to the load factor, and also we have to optimize the capacity of the transport. We will add more transportation means, and especially we will need to pay attention to the transportation to certain hotspots and the city spots in China, and also we will bring in more buses and the charter buses to provide services to the passengers. And we have to make sure that for all of our passengers will not be centralized or concentrated in certain places. And we will provide a lot of services to the vulnerable groups, including the pregnant women and the elderly people. When necessary, we will open up more ticket selling platforms, for example, to the elderly people and the young kids. We will help them to fill in their personal information and check their personal health code. And also, we will provide some preferential policies to the medical workers. And for the key groups of people, for example, the migrant workers and the students, we will provide one-to-one services and the charter services to these people. And also, we will dynamically monitor the traffic situation in the road transportation and the water transportation ports. And especially in the highway toll gates, we will also monitor the situation of the traffic, and also we have to improve our capacity to deal with the traffic congestion. Fourth, we have to focus on the safe production. For the local transportation authorities, they have to work with the local enterprises and to screen out some of the potential risk for the cargo transportation. And also, we have to make sure that for certain vehicles, they are not allowed to enter into certain places. And at the same time, we have to provide the monitoring at the remote end. And we need to do our best to reserve some of the key supplies. And in certain adverse situations, we need to provide some of the services to the customer who have been stranded in certain places. Thank you. Next question, please. We start news. So right now, my question is about the vaccination progress. What is the current status of the vaccination progress in China? I would like to turn over to He Xinhua to answer your question. So thank you for your attention and concern about the vaccination progress in China. According to the deployment of the National Health Commission, so still we will provide a lot of services to the general public, and also it is declared that it is the obligation and also the responsibility for all the Chinese citizens to receive the COVID-19 vaccination. And also we are focusing on the vaccination work for key groups of people. According to the actual situation, we will continue to educate the vaccination progress, and also we are able to improve our services to the people who need to receive the vaccination. As of January the 14th, a total report of 2.928 billion doses of vaccines have been administered. So we have over 400 million doses administered to the age group between age 3 to age 17. So this accounting over 80% of the total population. And also 1.2 billion people in China have been fully vaccinated, accounting 86.5% of the total population. So right now we are seeing many cluster outbreaks in different parts of China. So on one hand, actually we are faced with huge pressure of the imported infection. And also, this will also have some relation of the vaccination rate in China. As I said, over 86.5% of the Chinese citizens have been fully vaccinated. If we look at this vaccination rate, this means that for some people, even though they are getting infected, they will not show severe symptoms. And for some of the people, even though they are getting infected, they don't have any symptoms. So this is also because they have been vaccinated. So after a virus enters into the human body, if this person was vaccinated earlier, this person have an immunity shield, and this will also help this person to fight against the virus, and also the virus will not be duplicated inside of his body. So that's why for some people, even though they're tested positive, they didn't show any symptoms. So if the vaccine is working, and then the virus will not have a big damage to the organs of this person. So if this person is not vaccinated, so the virus will duplicate inside of his body, and also it will have a huge damage or impairment of the organs, and this person will show some of the symptoms. So if that is the case, meaning that that person did not receive any vaccination. So in summary, even though you are vaccinated, it does not say you're 100% safe from the virus. For some cities, we are seeing, for some cities, they reported like over 10 cases, and some cities reported hundreds of cases. However, if we look at the total population of the city, the infected group is only accounting a very small portion. So according to our analysis, effective vaccination will reduce the possibility for people to develop severe symptoms. So even though you are vaccinated, make sure that you still wear your mask and do not gather with others, and also you have to mind your own hygiene on a day-to-day basis. And all of these measures will help you to get exempted from the infection. And also, if you're getting vaccinated, it is not likely that you will develop severe symptoms. So vaccination still plays a very key role in preventing and controlling the epidemic. So going next, the National Health Commission will continue to provide guidance to different places to roll out the vaccination work so that we could protect our people. Thank you. Next question, please. With the paper. So my question is about the epidemic happened in Tianjin. For some of the infected people, we are seeing that some of them are actually young kids. So my question is, what measures will be taken by us, especially for the epidemic prevention control work in the schools? So how to manage the students and the teachers who are staying in the mid and high-risk regions in Tianjin? So once again, Mr. Wang Dengfeng will answer your question. First of all, thank you for your concern for the situation in Tianjin. We are aware that from November last year, actually the epidemic may have some relation to the universities and the schools. With the guidance of the State Council Interagency Task Force, the Ministry of Education already formed a task force to several affected cities. And we will provide guidance to the local education authority to do a good job in the epidemic prevention and control work, and also to ensure the health and safety of our students and the teachers. So in Tianjin, we are taking the four following measures. First, so we will manage the pedagogical activities and suspend classes in certain places. Start from January the 8th. In Tianjin, we actually already closed down all of the offline teaching pedagogical activities. And start from January the 9th, we also suspend some of the tests and the examinations. So start from January the 20th, so all of the schools and universities will enter into the winter holiday. By taking all of those measures, we are able to reduce the possibility of gathering so as to curb the spread of the virus. Second, we will impose lockdown management for the universities and the colleges. No matter where you are, even you are in a low-risk region in Tianjin, still we will have a lockdown measure for the colleges in those places. We will prohibit personnel entering into the colleges. And also for those who are staying inside of the campus, we encourage them not to gather. And this is the same strategy to all of the colleges and the universities. So for the universities and campuses in the control areas, on top of the measures I have mentioned, they have to work with the local CDC, authorities and the Public Security Bureau. They have to take their nucleic acid testing when necessary, and also to report their personal information when needed. And also for those students or teachers who leave the city of Tianjin, we also have to pay attention to their health condition. For some of the schools in Tianjin, they already end the semester before January the 1st. That means for a large amount of people from Tianjin, they already leave the city before the epidemic occurs. So for people who have left Tianjin from the end of December or early January, we have to make sure that we have a good understanding of these people's health condition. We have to make sure that these people can report their personal information to the local community, and also all of these people take nucleic acid testing when needed. So by taking all of these measures, we are able to contain the spread of the virus. And fourth, we will provide all-rounded services and humanitarian care to all the relevant people. For all the schools in Tianjin, first we have to make sure that information release is transparent and open. We need to make sure that all of these information can be accessible to all the teachers and the students, so they know what to do and how to exercise all of those measures. Second, we have to provide guarantee to these people, including the daily necessities and supplies. Third, we have to provide humanitarian care to the teachers and the students. For example, if some people need medical care, we have to provide support to those people. When necessary, we will provide psychological counseling to those people. Next question, please. With Hong Kong commentation. So in the province of Shanxi province, and many colleges are still under lockdown. So what measures will be taken by the Ministry of Education to ensure that the needs of the teachers and the students could be met? So thank you for your attention to those who are staying in the province of Shanxi. So for all the colleges and the universities in the province of Shanxi, actually, in 14 days, there are no new cases reported in the province of Shanxi. So actually, we are at the last stage of the epidemic in the city of Xi'an and the province of Shanxi. But as we mentioned, there was still a large group of people who are staying inside of the schools in Xi'an. So for the low-risk regions, actually all the 37 campus, 37 colleges, they already enter into the winter holiday. So for the students, and they will not stay in Xi'an during the Spring Festival. And at the same time, we have to look at the situation in different parts of China and then come up with a holiday plan for the local colleges. And also during the examination for the postgraduates, and I believe for some students, they are still stranded in the city of Xi'an, and they are preparing for the postgraduate examination. And for some of these group of people, we already help these people to leave the city of Xi'an and go back to their hometown. Because of the postgraduate examination, we have some students who have traveled from other cities to the city of Xi'an. And right now, we have already handled this group of people and facilitate them to go back to their hometown. And also this time, for the Ministry of Education in Shanxi, they also pay a lot of attention to the students who are still staying in the city of Xi'an. So in the past, many people are asking if we have a large group of students who are staying in the city of Xi'an to have the Spring Festival, are we able to provide the daily necessities and supplies to those people? Actually, the local government in Xi'an is confident about providing all of those supplies to the teachers and the students who are staying in Xi'an. And the second, except for the daily needs and their medical needs, and for some of the students, they would like to study and also have some recreational activities on campus. We also need to do our best to fulfill their needs. Also, we have already received some of the support from the Ministry of Transport so that we are able to provide the daily necessities and the anti-epidemic supplies to the teachers and students who are staying in the colleges. And fourth, we still have to exercise the epidemic prevention and control measures to make sure that all of our teachers and students are safe in staying in Xi'an. And right now, for all the colleges in Henan and Tianjin, they already come up to the winter holiday. So especially among the 157 colleges, they already ended their classes. And we have over 26,000 students staying in around like 30 colleges in the province of Henan. And also, we will provide sufficient supplies to those people who are staying in the province of Henan. Thank you. Next question, please. With Macau Monthly News. So on the 17th, we will start the Spring Festival travel rush, and soon we will have a huge passenger flow. So my question is, what measures will be taken by the Ministry of Transport to contain the spread of the virus? Thank you for your question. During the Spring Festival travel rush, we may have a huge population flow, and also it will bring us like higher risk of the transmission of the virus. So this year, actually, we have set up a special task force for the Spring Festival travel rush. For the Ministry of Transport, we'll work together with 14 departments, and we have already organized a number of video calls to make arrangements for the Spring Festival travel rush. So this year, we will focusing on reducing the risk of the transmission of the virus during the travel, and we are focusing on 4 areas. First, we will provide guidance before the travel of the passengers. So for the Ministry of Transport, we'll work with different departments. For example, we will encourage the migrant workers to make their travel in a staggered manner. And also, we will encourage the tourist site to come up with the appointment system to receive the visitors. And when necessary, we are able to provide the charter flight and also the charter buses to provide services to the travelers. And the second, we will pay attention to the prevention and control of the transportation means, train stations, and the airports. So we have to disinfect all of those terminals, and I'll have to check the health code of the passengers and also to check their body temperature. We have to supervise their prevention and control measures. For example, all of these passengers need to wear the mask and also stand at the 1 meter line. Also, we will encourage the online service so that we don't have much of the face-to-face contact so as to reduce the transmission of the virus. And also, we will pay attention to the load rate of all the transportation means. And at the same time, we have to monitor the health condition of people who are working in the Civil Aviation Administration and from the China Railway Group. And of course, we have to pay attention to the safety of the borders. For example, the road transportation borders and the water transportation borders. So we need to adopt the point-to-point services, and also we will roll out the closed-loop management. And at the same time, for people who are staying in the high-risk group, we will bring all of these people inside of a quarantine area. And also, we will roll out frequent nucleic acid testing to these people, and also to check the environment for all of these places. And also, we will roll out more disinfection to the surface of the objects from the road transportation and the water transportation borders. Fourth, we will prepare a contingency plan. We will provide guidance to local authorities. In view of different situations, we will study the situation and also to prepare the contingency plan to make sure that we could reserve enough supplies. And also we could make sure that we have a strong team to deal with the emergencies. And also I would like to give a reminder to people who have their travel by using their own vehicles. So make sure that you scan your QR code, and also you could show a valid nucleic acid testing and minimize your stay in different toll gates so that you could also make your contribution in the Spring Festival travel rush. 2 last questions, please. With CGTN, recently we are seeing that the global pandemic is accelerating, and also we are seeing some of the cluster outbreak in different parts of China. So right now there may be a higher risk in having the epidemic in different parts of China. So my question is to the Civil Aviation Administration: what measures will be taken by the Civil Aviation Administration to ensure the safety? So during the Spring Festival travel rush, so we have to exercise the general guideline to prevent the import infection and domestic rebound. So for all the inbound travelers, so we have to monitor all of the process. For example, we will do disinfection and ventilation to the terminals and the waiting halls. And for the key groups of people, we have to bring all of these people into a closed-loop management. Second, for the airline companies, they have to work with the local government. They have to show their health code and also to have their body temperature track. And also they have to advise all of the passengers to stay put in their seats and also to wear a mask throughout the travel. Third, when necessary, we will roll out the flight suspension policy. In the 2021, we are able to roll out 268 times of the flight suspension. And also in the first half of the year, we are able to provide the 74 times of the flight suspension. So we have to keep an eye on the epidemic change in different parts of China. And also we have to study the epidemic prevention and control measures in different cities in China. We have to check the health code of all the staff members and the passengers, and also we have to monitor their temperature. And also we need to make sure that all of these passengers can clean their hands before they board the aircraft. And also we will improve our procedures to offer the meals to the passengers. And if the flights will arrive at a high or mid-risk regions, we will actually reserve 3 rows of seats as quarantine areas. If there are some passengers develop symptoms such as fever, coughing, these people should be kept in this quarantine area. And during the Spring Festival, we will also provide more education to the customers. And if some of the passengers develops fever, we will bring them to quarantine as soon as possible. And also, we need to increase the frequency of this infection in the airports and different terminals. And also, we need to supervise and provide guidance to the local authorities to strictly abide by the epidemic prevention and control measures during the Spring Festival. By doing all of that, we could ensure that for all the passengers, they could enjoy a happy Spring Festival. One last question. From the 21st Century Economic Daily. So what happens if we found some of the passengers that came from the epidemic-related cities? So what measures will be taken by the China Railway? So you actually raised a very good question. I believe many people attach great importance to this issue. For the China Railway Group, we have actually come up with different scenarios. For example, if some passengers they are coming from the epidemic-related regions, we will take 5 measures. First, for the concerned passenger, we will bring these people to a quarantine site inside of the train. Second, we will report to the local authority. In the next station, we will bring these passengers off, and this person will be sent to a local authority for further observation and quarantine. Fourth, in accordance with the prevention and control measures from the State Council Interagency Task Force, we will collect the information of the carriage where the epidemic-related passenger stays. And this will also help the local authority to monitor the epidemic situation. Fifth, we will roll out an overall disinfection for the carriage where the epidemic-related passengers stay. So once again, thank you for our guest in introducing us on the epidemic prevention and control measures during the Spring Festival. Also, they are giving out a lot of reminders to the passengers during the travel and during the Spring Festival. For all the passengers, make sure that you wear your mask, wash your hands frequently, and also make sure that you do a good job in the vaccination during the Spring Festival. If you develop symptoms, make sure that you report to the local authority. So wish all of you a happy Spring Festival. And we will have more press conference coming up in the future. So that's the end of today's press conference. Thank you.